Good evening, Sean. My name is Ashmina Thapa, one of the registered nurse who is working in the Napier Hospital. Welcome to the interview. Today, you will be given 3 questions from this, and among that, you have like 12 minutes in minimum and 15 minutes maximum to give your answer for the 3 questions. Are you ready for that?
Thank you, Ashmina. I'm ready.
Oh, good. All right, Sean, moving towards your first question from the set B. I'm going to ask you the question. So if you feel like any confusion or if you want me to repeat the question, just let me know, okay? Feel free.
Yes,
So
thank
your
you.
first question is, you have witnessed a medical officer approach a patient, women, to examine them without washing their hands. You know that this is against infection control policy and practice. So, what are the professional, ethical, or legal issues that you would consider, and what actions would you take? Yeah.
Thank you, Ashmina. In this scenario, I would like to them into 3 domains to discuss, which is professional, ethical, and legal. So as we coming from the professional part, I think we all recognize that the importance of hand hygiene is cannot be overemphasized. Uh, Performing a good hand hygiene is actually one of the most effective way to minimize the risk of infection, which is very common in hospital. So by understanding the importance of hand hygiene, it's actually a way how we demonstrate our professionalism. And as I want to mention about the ethical part, it's about like if we have a lot of time standing in the hospital, we might made a mistake. But making a mistake is not unbearable. And how to raise the concerns of that mistake is also requires more smart and intelligence. In this case, I would try to use euphemisms and giving that medical officer an out. In other words, giving them a second chance to correct the mistake they have already done. And as we move into the last part, which is the legal part, if the health professional is not performing well hand hygiene in their job and causing infections or the breach of patient safety, we are actually legally we are actually able to be prosecuted and be facing the punishment. And so, in conclusion, by considering all domains of this problem, here's the actions I will take. If I walk into the medical officer approaching to a patient without washing their hands, I will grab alcohol-based hand rub, approaching to them, and invite both of them to wash their hands with me thoroughly. It's, by doing this, it's actually raising the concerns of the medical officer, using another way to ask them to rethink about what they have forgotten. I believe that the medical officer, after years of training, they definitely could realize that they didn't wash their hand. But instead of saying like, "Doctor, you didn't wash your hands at the first place," that in that way we might bring another level of conflict, especially in front of the patient. And this is the thing that we're trying to avoid in a hospital: conflicts. Also, by doing a very good hand hygiene, it's actually minimizing our risk of being legally prosecuted and being legally charged. So here's my action. Thank you.
That's good. Moving towards your next question. Your next question is, a fellow registered nurse slash registered midwife arrives 30 minutes late for work regularly, which means that they often miss the handover period. So, how might this impact on the assessment of a patient, women's needs, and the care provided, and what action would you take?
Thank you, Ashmina. Time management is one of the commitment of nurses to our jobs. Being on time and taking care of the patient is very important because we're trying to take care of the patient with 24/7. If a person was constantly late and missing the handover, here are some of the breaches that he's at danger of making. First, if you couldn't get a thorough picture of your patient, you might not be able to keep up a good plan of taking care of that patient during the shift. Second, you are not mentally prepared to start the shift. In other words, if you're starting your shift at 7 a.m. in the morning, but you constantly arrives at the hospital at 7:20 or even 7:25, you are not mentally prepared and stable to stay on the floor and start your shift. You might not be ready to put your bags in the locker area. You haven't you haven't gone to the washroom, and you might just out of the situation. So being on time is very important for nurses because the patient safety wouldn't wait for us. If a patient deteriorates, also brings the legal problems, which is the responsibility. If the personnel was late and the patient was in danger, who is going to take the responsibility? In this scenario, if I found someone who was constantly late, I will invite them and have a meeting and discussion with my according manager or supervisor. In this case, the manager and supervisor can raise the concern of this problem and then further discuss about the propriety and then figure it out a way to solve this problem. Thank you.
That's good. Okay, moving towards your last question, which is question number 3. So, how do the NSW Health Core values of collaboration, openness, respect, and empowerment relate to your role as a registered nurse or registered midwife? Provide an example from your clinical practice.
Thank you, Ashmina. I acknowledge that in every field of working, having a guideline is important, not only for the workers to follow, but also to discover the true value of their job. So for health professionals, the NSW Administration has provided a core value which stands for collaboration, openness, respect, empowerment to all the health workers within New South Wales region. In, in my experience, collaboration is very important, especially to the nursing job, because nursing jobs relies on teamwork heavily. As working as an AIN in a rehab facility, we often encounter someone requires to assist with manual hoisting. Simply think about this. If you're working on your own and reluctant to work with another person, how can you perform a good manual handling? You cannot. In that way, you cannot fulfill your job. As I move on to the openness part, it is very important for nurses to remain open to all sorts of information. As we move on and grew up in the hospital setting, some people will become self-isolated and become reluctant to learn anything new simply because of them just don't want to learn. But it is very dangerous. As we move on into this generation, knowledge, information were updated on a daily basis, even minutes basis. Every time we have new things coming out and requires health professionals to update their knowledge instantly. As we trying to as we trying to implement person-centered care and evidence-based nursing, it is very important to get every source of information from everywhere, including the patient, books, internet, and papers. So I think in my experience, we often ask patients about their thinking. It's not only because we respect them, but also we want to learn about the things that we might be we might not realize. So being openness is very important. The third part is respect. The diversity of this country is the beauty of Australia. We have all sorts of people coming from all around the world into Australia. So it is very important to learn the ability to respect others. Being respectful is including respect their life, language, way of living, culture, even their customary. Working as an AIN in the rehab hospital, we sometimes have the patients who was Aboriginal people. They might not have the same background as we did, but it is a good chance for us to learn a different way of living. Often I will ask them, oh, what is the way that you prefer to do, and what is the way that you usually do in your life? By exchanging opinions and information, it's actually giving ourselves another way to learn the different way of living. Reflecting to the second part of openness, it also helps us to keep an open mind. The last part, empowerment, is also very important. Working as an AIN in a rehab facility, empowerment is the most important key. We are standing on the front line of the healthcare system, but the patient are not remaining at the front line at all times. They're coming here for the immediate treatment, but after that, they will be discharged. And once they got discharged, they have to be implanted with adequate knowledge and information to know about their care and what is the most suitable way to take care of themselves. In our hospital, we tend to let the patient guide us instead of teaching or telling the patient what to do in the morning. So as we moving into the patient and starting our daily care, we will ask the patient, what should we do first? And what is the reason behind that? Why this is very important to have the breakfast, and why this is very important to do the bowel care, and what is the importance of changing position regularly. These kind of questions will actually emph- uh, emphasize their memory towards their care. By letting them telling us, it's actually letting them to learn again about their care, and later on they can implement it after they got discharged. So by include in conclusion, the core value of New South Wales Health Administration is not only guiding us, but also waiting for us to discover within our jobs. If we look deeper into our jobs and daily performances, we can actually find the core values is in every domain of our job and is with us all the time. Instead of being a guideline, it's actually a beauty of our performances. Thank you, Ishmina.
Thank you, Sean.